Hello, Dr. Mini.pg, Specialist Gynecologist, ALRUKN Medical Center, Ajman. Today we can discuss about Placenta Accreta. It is a rare problem. In this case, the placenta will attach inside the uterine musculature. Uterus is having inner lining endometrium, then muscle layer myometrium, and outer covering perimetrium. Usually the placenta forms in the endometrium, and after birth of the baby, the uterus contracts and shrinks, and thereby the placenta detaches from the uterine wall and it will expelled out. This is placental separation. But sometimes this placenta get attached to the muscle wall, myometrium, and that is called placenta accreta. Then sometimes placenta invade into the myometrium, that is called placenta increta. Then sometimes this placenta extend throughout the muscle wall and comes out to the outer surface of the uterus towards the perimetrium, and it can sometimes extend to the bladder and rectum also. That is called placenta accreta. So if it is there, means after delivery of the baby, this placenta cannot be delivered properly. It won't separate and expel out. This is a critical dangerous complication of pregnancy. It can be diagnosed by ultrasound scanning or sometimes needs MRI scanning also. If we find out a placenta accreta, increta problem, that delivery should be a cesarean one. And during the cesarean, sometimes if the extent of the placenta is in deep inside the muscle wall or outside the uterus, in that case sometimes we need to remove the uterus as such, because this placenta is a very bloody organ. It is having increased vascularity. If we try to separate the placenta in piecemeal, that can cause a severe bleeding. In some cases, rare situations, this placenta only cut out from the uterine muscle wall and the uterus restitched. But this all causes a lot of bleeding. And to arrest the bleeding, sometimes we have to tie up the uterine artery. Both uterine arteries should be ligated. It is a very complicated problem. Then sometimes if we couldn't remove the placenta, want to conserve the uterus, in that case we will clamp the placenta and leave it as such and give methotrexate to dissolve the placenta. But this also can cause problems like infection, sepsis, heavy bleeding. All the problems can occur. So even though it is a rare complication, we should be vigilant about this.